Medications to treat mental illnesses could put patients at higher risk for health issues during extreme heat. Here to answer your questions is Dr. Cristina Montalvo, a psychiatrist at Tufts Medical Center. Nice to see you, doctor.
Great to see you, doctor. Obviously, we're in a week of extreme heat. It's expected to be hotter than 90 degrees every day, at least through Sunday. So what do we need to know about the link? Is there a link between hot temperatures and our own mental health?
So there are changes that can happen to anyone, but specifically those with mental illness can be at higher risk. We can see changes in irritability, aggression, in worsening insomnia, but also overall there's an increase in human conflict, and that can manifest as violence towards others, where we see in the hospital an increase in the number of traumas that come into the hospital, as well as violence against oneself. Specifically suicide, and there has been some literature to show that there are increase in the number of suicides during the summer months.
Doctor, the CDC says that people diagnosed with a mental illness could experience a surge in symptoms during this extreme heat, and that they are more likely to visit the ER. So is that what you're seeing right now at Tufts?
We are seeing a bit of that. What happens is we also know those with mental illness are more prone to living in poverty, which means less access to air conditioning, cooling environments. They're also more likely to have comorbid medical illnesses. So they're going to be the ones who have cardiac disease that put them at higher risk of worsening conditions due to the heat. So a lot of them are just seeking shelter, or they're developing worsening mental status changes because of the heat.
Doctor, many patients may not realize that some antidepressants, antipsychotic medications may put them at a higher risk for overheating. What can you tell us about the warning signs that we should look out for?
So certain medications, including antipsychotics and certain antidepressants, can change the way that your body manages changes in temperature. And so when we think about warning signs, it's going to be people who aren't thinking the same way. Certain mood stabilizers, so for example, some people might take lithium for their mental illness, can develop toxicity because they're dehydrated, they're not drinking as much. And so if they're acting differently, not walking the same, having more falls, it would be best to bring them into the emergency room because they need medical attention.
Thank you, doctor.
Interesting information. Thank you, doctor.
Great to see
Stay
you.
well.